So in this video, I'm going to be talking to you about what to expect when you come for your Mediport removal. And this is something that I enjoy doing a lot because, as we know, when we put the Mediports, it's usually because patients have been diagnosed with cancer, which is a very scary moment, and we're seeing them for the first time, and they need this device that goes into the jugular, and they are expecting to get chemotherapy. It's all really scary. But when the patients come back for the Mediport removal, it's certainly a very different situation. Like, they just finished their treatment, they are done. Usually they are sure their cancer is gone, they're in complete remission. So it's a very happy and special time. So that's why I like doing it, and I'm gonna explain what to expect from this process. So I assume you know what a Mediport is since you have one, but if you don't, you can watch my other video about Mediports. So the first thing when we're gonna remove a Mediport is we wanna make sure that we're in the same page with your oncologist and we are all sure that you won't need this device again. The procedure is really simple. We do this in the office just with local anesthesia, so it's very convenient and you can drive yourself to the procedure and drive yourself home. The procedure is really quick and typically takes me only about 10 minutes to do. Not even that. During the procedure, we obviously clean the area carefully and then we inject lidocaine to numb the area. The lidocaine may burn and sting for a little bit, but you know the drill. It'll go away and will everything be numb. We then make about a 2 centimeter incision, a little bit smaller than an inch, and we dissect the Mediport and gently remove it. We then close the incision again with absorbable sutures that will dissolve by themselves, so you don't need to come back to remove the sutures. Again, it's all very simple. Patients are often very worried, like, what about the catheter was going into the vein? Is it gonna bleed from the hole after you remove the catheter? And the answer is no. Well, for starters, the vein has a low pressure system, so usually any bleeding would stop on its own almost right away. But also we tend to put a little stitch in the area so we'll prevent any bleeding. Yeah, severe bleeding is never a problem with this. We usually use a surgical glue, also called a liquid band-aid, in the incision. Sometimes we can use Steri-strips. It's very important that you tell us if you're allergic to the glue or to the Steri-strip so we know what the right thing to do for you is. Again, the minute we are done with the procedure, you can get dressed and drive home. You should be able to do your normal activities throughout the day, and you'll be able to take a shower that same day of the procedure. It's also normal to have some bruising at the procedure site. You'll also be sore for a day or two after the procedure, but it's usually not that bad and it will go away fairly quickly. Most patients don't need any pain medications afterwards, but feel free to take any over-the-counter pain medications such as Tylenol or ibuprofen if you have any pain. Complications from these procedures are really rare. The main risk would be a rare risk of an infection, and if you do get an infection, you would start about 4 to 5 days after the removal, and the wound would get progressively more red and more painful over time. If that happens, you need to let us know. Some patients can also develop what's called a hematoma, which is a little raised bump area in the site of the procedure, which usually means there was some bleeding at the pocket size. It will usually resolve on its own. In rare cases, we have to drain the hematoma, but it's rare, and even rarer that we need to do something about it. Anyway, you should let us know if you develop worsening of pain, redness that gets worse over time, or any discharge at the procedure site. Although, like I said, you're free to do your normal activities after the procedure. You should avoid swimming or activities that involve the upper body, like doing chest presses, for a week or two after the procedure until the incision is completely healed. The message here is Mediport removal is a big milestone, marking the end of probably one of the worst chapters in your life. Our team is here to ensure that the process is as smooth as comfortable as possible. As always, if you have any questions or problems, please let us know as soon as possible. We hope your Mediport worked well throughout the process and you didn't have any problems. I'm sure for most people it's a big help throughout the entire process.